that we are very interested in hearing and learning more about. Welcome, Debbie.
Thank you.
Debbie Cameron is our special guest. Welcome to Spotlight on New Market. Debbie, we're
Hi,
to have you.
Hi, everyone.
Okay, so Debbie is joining us from Missouri in the United States, and she is a hardworking nurse, as you may imagine, being one of the persons who is out there fighting the virus at different levels. So it's kind of rough on nurses here in America, as it would be in any other part of the world in the COVID era. So we really appreciate you taking your time out to join us here, Debbie, to have this very important discussion about mental health. This is something that ravish almost any part of Jamaica you go, but
Right.
very little is said about mental health. And I think it's time that we put more emphasis on it in terms of educating people on mental health. So here we go. So your connection to the area is pretty interesting. You were not really born in New Market, but you have very strong ties to the area. Your
Yes,
mom,
yes, I do.
your mom is actually from what's the district that they're from? What's the name of the district that your mom comes from up there?
I don't remember right now, but I know
it's somewhere near Brighton or somewhere up there, right?
right.
Right. So this young lady is the niece of the former principal of Beersheba, Miss Tatlin, and those ladies, the three sisters who were on here last week Thursday, those are her aunts, right? Her mom wasn't on, but the other three ladies who were on the panel discussion, those are her aunts. The Bright family, you all remember them? So, and your Horace Burnett is also your uncle, right?
Yeah.
Right. And we had the young lady on here who was an artist also. She is your cousin, your first cousin. So yeah, the Bright family.
Yes.
So we're really getting to know you guys, and we really appreciate working with you and being able to benefit from your expertise. So yet another one of you is here. Can you tell me about your early days, just quickly, since we're not really focusing on your education, but tell me, where did you go to high school?
All right, so I grew up in Hayes, Savannah.
Okay.
Went to Garvin Masio High School.
Mm-hmm.
Is in Vernon Field. I'm not sure if you know where that is.
Mm-hmm.
Yes, that's where I went to high school, and then I eventually did sixth form in. Oh well, I didn't actually finish Garvin Masio. I did my fifth year last year at Central High.
Mm-hmm.
And I graduated and did sixth form at Bear Technical High School.
Okay. And
yes.
then where did you do your nursing?
Well, I went to Northern Caribbean University and I did 4 years.
Okay.
Yes.
So you are a well-trained nurse.
Yes, I
know they don't play with you guys at NCU, so no,
they're very rules that you have to follow.
Nursing at NCU is no joke. So if you graduated from NCU as a nurse, you're a good nurse.
Yes.
Okay, so congratulations on your success. And
thank you. I appreciate it.
Great, thank you. And you worked 5 years at Bellevue Hospital in Kingston?
Yes, I did.
Okay. How was that for you?
Well, it was an experience and a half because I didn't really know much about mental health until I started working at Bellevue Hospital.
Mhm.
It like opened my eyes to such a, I think it's a different world,
Mhm.
different kind of diagnosis, to see the patients from this particular attitude to this particular behavior. It's like they come in and they're a totally different person, and once they start to get treatment and support, they go back to their normal self. So it's a, as I said, it's a different world, it's a different experience, and I think everybody needs to like open up to mental health because it is very important, and it is very interesting as well.
Okay.
Yes.
What made you choose to go into mental health? Did you kind of know you wanted to do that from you were in college, or is it that that's where you got a job, so you just went over there to work?
Yeah, I mean, that's where I got the first call back, so that's where I went.
Okay.
But but I am glad that I did because I actually love it now.
Okay, that's wonderful. That's
Yeah.
wonderful. So, what kind of cases did you normally deal with? You're still working in mental health in
Right.
America.
I do.
So tell me in
Well,
general, what are the kind of cases that you work with on a day-to-day basis?
all right. So basically, the conditions are like schizophrenia. Probably you have heard of that before. Major depression, um, schizoaffective disorder, bipolar disorder. Um, we also have like mood disorders, psychosis. So it depends on what feature the person is presenting with.
Mhm, mhm.
So those were the main ones. And then you will have like personality disorders. Because most of the time these persons with mental illness, they have personality like borderline disorders,
Hold on a sec.
antisocial disorder.
Your the reception is acting up, so we're not hearing
Oh,
your
oh,
voice clearly. All right,
are you hearing me better?
a little bit better now. Yeah. You know,
All
the
right, so
internet
I was,
works. It comes and goes. So yeah,
oh, okay, I'm sorry about that.
that's okay. You can speak now. If,
All right, so I was saying that I have experienced persons with schizophrenia,
uh-huh.
bipolar disorder, schizoaffective disorder.
Hmm.
It's like schizoaffective disorder is like a mixture of both bipolar and schizophrenia.
Hmm.
Persons with major depression, mood disorders, psychosis. So those are the main ones that I experienced. And they also have like personality disorders as well, such as borderline, antisocial, and narcissistic personalities.
Okay. How are we able to distinguish these behaviors? Because some of these are pretty close, like
Right. So
borderline personality, bipolar. How are we able to tell which is which? If we have someone in the home, and we know something is obviously wrong, but
right.
we're not supposed to be the ones making the diagnosis. But how do you know that the person is ill to the point that they need to get help? They're
All
acting
right.
a little strange, but you're not sure what's going on.
All right. So basically, it depends, like certain features, what the person is presenting with, like how long they have been experiencing this. I would like give an example because basically when they have this disorder, they're not able to function normally. The certain things that they usually do before, they're unable to do it. So let me give you an example. All right, so somebody with bipolar disorder and somebody with schizophrenia. So with schizophrenia, um, these persons might be hearing voices, right? You might see them speaking to themselves. Um, they're not taking care of their hygienic needs, like they're not bathing, they're not combing their hair. Um, Another example is that they are very paranoid because they might believe persons are trying to harm them. So they have like disorganized thoughts. So that is schizophrenia. And you have to be experiencing schizophrenia for a couple months for it to be diagnosed as schizophrenia. With bipolar disorder, it's like a different modes, like a spectrum. So at some point you may be manic, meaning that you are hyper and always happy, elated. And then the other spectrum, you may be depressed. So you may not want to eat. You really don't care about how you look. Your energy is just low. You might feel hopeless, and you have to be experiencing those conditions, like I said, for a couple months.
Okay. So is that some of those things that you described to me, is that not the same thing that people would look on and say people work obi on you?
Well,
I'm asking for a friend.
well, I mean, like patients, some of them will say somebody obi them, and or even family members might believe that.
Right.
But once they start to take the medication, you see the difference in their behavior.
Yeah, so I brought that up because it's a common thing that when things go wrong in the community, instead of trying to get real medical help, people will start to resort to saying somebody work some obi or set some spirit or some ghost on you. Therefore, they go looking for other treatments instead of the treatment that they should be getting for these individuals. So the illness is left there to go on and on. Someone who has like mild cases of these illnesses and it's left untreated, does it escalate into worse thing, or it basically stays at the same level? How does that work?
I mean, like, you have some patients that are fairly calm, but you have some patients who are really aggressive, like very aggressive. Like they have like cases where they physically harm a relative, their mother, broken their mother's arm, damage their house, burn down the house. So trust me, you have persons who will be very dramatic and do certain things that it's way out of the ordinary.
Yeah. But again, it comes down to how does the person who is not educated about these illnesses, how do they determine that they need to force this person to go to the doctor? How do you suggest that they go about, especially if the person is physically more on the violent side and you can't talk to them and they're not going where you want to take them? How do you advise that they get help, or what can they do to get this person to go to the doctor?
All right, so most of the times they seek assistance from the police.
Okay.
Because if it's a case where they're very aggressive and they're not willing to go to the hospital on their own, you can get assistance from the police, and they'll come and they will get the necessary information, and then they'll assist you in bringing the patient to the hospital.
So that works in Jamaica. I'm talking about in the context of Jamaica. I know in the United States, all you have to do is call 911.
Yeah, that's what they did in Jamaica.
They did that.
Right. Once they're acting up, they will call the police, and also there is like a mental health team.
Okay.
I think parish should have more than one mental health team. So they have a number that you can call, and you can say, hey, I have a relative who is behaving this way. I think he needs assistance. So in terms of like, you can call like the health center and see if they have like a mental health team, and they can assist in finding that person to help and come and bring the patient in for hospitalization.
What if the person is not acting up? Do they still come? if the person is there talking nonsense, doing odd stuff.
Yeah, they come. Because sometimes these mental health persons, they just go to the area just to give them their injection. So if they wish not to come to like follow-up care, they go to them and say, hey, I have your injection or so forth, and they'll give it to them and then they'll leave.
Okay. Guys in the group, in the chat, can you tell me if you have ever seen any of these mental health professionals around the New Market area? Because I left there a while back, so I don't want to make a statement that it doesn't exist, but I've never seen it. And I know of a lot of cases of people who are in my area that suffer from mental health issues, including family members, but I have never seen anyone who has tried to intervene or help from a professional standpoint. And when I say mental health cases, I mean affecting young people as well as older people, very young people. I know of a case of a young lady who was a university graduate doing her stuff. She got sick, and she's taken out of the workplace now, just sitting at home for years and not receiving any real help to rehabilitate her so she can go back to work. What do you think about a case like that? Somebody just gets ill for whatever reason, and this is a young person like yourself. Imagine you stop working and just go sit down at home with your education and your everything, just out of that life, out of that world, and you just put in place in another world, and you're just there with no professional assistant to help you to go back to work. Because here in America, if something like that happened, there's always a way to help the person, put them on meds, try this, try that, until they find, something that works, so that the person can come back to some kind of normalcy and return to their life, their professional life. But there in Jamaica, I don't know about that happening. I don't see it. It may be happening, but I don't know. You could tell me.
Well, I'm not sure if it's in that area, but I know for sure that we had assistance from police officers or the mental health team. So if it's not in that area, that is something that needs to be put in place. So like those persons who are suffering from mental illnesses can get the help needed. Because a major factor with persons that are with mental illness is their family. Like their family has to be very supportive, because they're not thinking properly, they're not in their right mind, so they do need assistance from the family. And once the family is not supportive, then it's very hard, and it actually makes the situation worse for the client.
Well, the cases that I know of, the family members are supportive because they're there, and these people are not running up and down on the street or anything like that. But there's the absence of professional help.
Okay.
There is the absence of professional help. No counselors coming around, nobody helping, trying to give them medication or whatever to stabilize. The community do what they can do, which is to provide shelter, food, whatever. And like I said, nobody's running on the street, because you would never go to New Market and really see a whole bunch of mentally ill people hanging out on the street and living on the street like that, because that's not a part of our culture. We tend to be more caring than that, thank God. But still, I have seen quite a number of cases of people who are suffering with mental health right there in the immediate New Market area. And so I don't see anybody doing anything about helping them. And if so many are just right there in New Market near the square in that vicinity, then I don't know how many would be in the other areas that are further over the hills, So it seems to be something that we need to focus on, because someone has mental health issues does not mean that they should be taken out of society, because they can be treated and live fairly normal lives.
Right. I don't think that Jamaica places like much emphasis on mental health. I don't think they do, and I think a lot more can be done to get like the whole community more acquainted with mental illnesses, because I mean it's collaborative, not just family. You know, family, people around, everybody can assist in helping like a mental illness, mental health person become better.
Okay, so Miss Tatlin said in the group here, there was this program that they used to get them, and every Thursday they have the mental health clinic in Black River. Maxine Smith said, yes, the police does help the mental health officers. Let me see now. Okay, Miss Tatlin said, good night, everyone, especially to my niece and Devadne. Hi, Miss Tatlin, thank you. Thank you so much for helping to put this together. Dr. Hamilton is here, Kevin Clark, Don Marie Smith, and so on. Guys, just write in the group for me what you know, what your experience about mental health, so we can have that discussed here. Are you guys in New Market receiving, Miss Tatlin said there used to be a program on Thursday. I don't know about it. I don't know how many people know about such program, and I don't know how we can see more of this activity so that the people who need help can get help. Because in some cases, these people are more borderline. In some cases, it might be schizophrenia, as you said. You know, it's not that they have to be mad, pulling out their hair, running up and down naked and at that level, but there are other stages of mental health that they do need help, but because there isn't a recognized program in the area, then these people are just left there to
right
on their own, when they could have been doing much better if they were getting some medical treatment for it. The other thing that I want to talk about is the medication.
okay
There has always been this feeling that the medication make people sick, sleep too much, put on weight. What do you think?
All right, so in terms of the medication, like every medication, there are side effects, but it depends, because most of the times with these patients, they do not take them consistently. So it's like your body's not able to adjust to a certain dose. And most of the times, like when they go to the hospital, they may be placed on like high doses or just to try and stabilize them. I know, well, most of the patients that I encountered had issues with taking the medication, right? Because they're saying, oh, it causes this and so forth. But once they take the required dose, and most of the times they're given like a meds for the side effects, to help with the side effects. So if they're not taking that meds together, it may cause that side effect that the medication is trying to prevent or try to treat the condition. So yes, there is a stigma that the meds causes more harm than it should.
Right.
But I believe once they take meds, how they're supposed to take it, and also, and another thing is, you can't be taking meds and smoking or doing things that might counteract the meds. Because if you smoke and do certain things, it might worsen or exacerbate the meds that you're taking. So if you're taking meds, you have to be ensured that you're on a balanced diet, you're not smoking, you're sleeping okay. Some meds do cause weight gain, but I mean, it's all about lifestyle and trying to exercise and do certain things to keep in shape, because you don't have to take medications to gain weight.
Yeah, you know.
Right.
I'd rather gain weight from something that's going to help me than not to take it at all.
Right. It's all about lifestyle and living the healthy lifestyle, eating right, sleeping, exercising. You have to do those things while you're taking medication, and you can't be doing things that might like interact with the meds.
Right. Maxine Smith here is saying that there is the health clinic at Louisville Health Center, and they have it every second Tuesday of each month. Is that enough? Once a month?
I don't think so.
No,
I think no, I don't think it's not enough.
it's not enough. It's not enough to have clinic just once a month and then you expect to rehabilitate patients. You know,
No,
it's not.
mental illness is like a medical condition where you need to be consistently monitored and taking the medications. You have to take, like with hypertension and diabetes, you have to take it. That is how mental illness is. You have to take the meds for as long as you live. So, yeah. I mean, it's a huge adjustment, I may say, because who wants to take medications for the rest of their lives?
Exactly. So you can imagine someone is sick and you carry them to clinic this Tuesday, and then you don't have any help for the next month.
Right. And suppose you miss that clinic date.
Yeah, come on. That's not enough. That is way not enough. And you have nobody going into the areas visiting these people to follow up on whatever. Come on, we need to do better than that. We need to do better than that. There are lots of people around New Market area who has mental health issues, and therefore we need to do better. We need to do better because they should be visiting these homes. These are not dirty people running up and down on the streets. So they should be going to their homes and try to encourage them to take their meds, you know, help to administer the meds and doing follow-up so these people realize that if they're consistent with the meds, then, you know, they can reduce it over time if it's affecting them. But if nobody's monitoring, how are you going to do that? How are you going to know if it's once a month that they're able to be seen by a nurse or doctor to deal with their issues? How are you going to be able to figure out what level of medication will or won't work? You know, I want to say darn nonsense, but you know, come on. It's come on, guys. We have enough nurses and doctors in Jamaica. We shouldn't be living like this. We should not be living like this. And when I see well-thinking, decent people who have resources or whatever, were doing their regular good jobs or making their living, not depending on society for anything, and they're taken down with mental health problem, but there's no help, no professional help. Clinic every Tuesday, what is that?
Well, I think what another issue is,
come on, yeah, go ahead.
Sometimes there's no what should I say, resource. There's not enough resources. But sometimes not every parish like has a vehicle that you can go and drive to this person's place or that person's place to give them the med or the injection or so forth. So in terms of that, we need like persons who are given certain resources that is needed to help travel and go to different patients and so forth.
The way I see it is, every other person in Jamaica has cars now, and if a family member has a need and the nurse needs to get over there or whoever, I'm sure there are other people in the family who could transport them, you know, if the government does not provide enough transportation for them. But we're just not paying attention to what's going on. That's just the bottom line. We don't think it's
mental illness. Enough emphasis is not placed on mental illness. And a lot of persons have like a wrong idea of mental illness. They're not educated about it. So they have that wrong stigma, and it kind of make it worse. Because like I said, it's to help to treat somebody with mental illness is like a collaborative thing. Everybody has to help.
Let me ask you this. Is a regular doctor well equipped to deal with mental health?
Well, I think in training they do mental illness stuff, but I think like the psychiatrists, they zone in on certain things, so the psychiatrists will be better able to care for these patients because they really hone in and focus on just mental illness. Not saying that the medical doctor wouldn't be able to assist. Yes, they can, but the psychiatrists are more specialized.
The reason why I said that is, sometimes you hear of cases where doctors tell people about, oh, you have to go seek other help. Literally telling people that medical medicine won't help, so they need to go to somebody else to go get treated. And these people interpret it as you gotta find an obia man to fix the problem.
Oh.
It's not ordinary. Even the doctor said you have to go seek other help, right? And that's pretty much what some of them want to hear. So they go out wasting their money trying to do all of these off the record things, which don't work, and the patient is still sick. So when you have a mental health patient, who are the doctors that you should be trying to get to? You should be trying to get to a psychiatrist instead of a regular doctor.
I mean, well, sometimes even if you go to a regular doctor and they prescribe something for you, most of the times they might refer you to a psychiatrist. Or well, I mean, Bellevue Hospital is there, and I've seen patients who have came from Portland, Montego Bay, Mandeville. I've also seen persons from, well, St. Thomas is close by to Kingston. So and Clarendon as well. So the parishes, different persons from different parishes do come in to Bellevue Hospital. That's like the main institution for mental illness, and you have a lot of psychiatrists there. Everybody's there. So
Cornwall Regional usually has a good program down there as well. But again, it's carting people off to these facilities that are far away. It's very expensive to hire someone to take you to Montego Bay or to Kingston to see a psychiatrist or whatever. So I think we need to it should be the psychiatrist that's coming in once per month, not the mental health nurse. That should be someone who is there all the time.
Right.
So it should be a specialist.
I'm not sure if you have a lot of psychiatrists like how you have medical doctors. I'm not sure.
Maybe not.
Maybe not.
Maybe not. But so you could see a specialist coming in once a month, not a regular nurse. Nurse should be there all the time. Nurse should be there all the time. And so we need to look at that, because people's lives are going to shambles because they're not getting help.
Right, and I agree.
And it's sad, very sad and heartbreaking when somebody, like I said, was a regular member, living independent, doing whatever they're doing in society, and something happened in their brain, and they end up having some kind of mental condition, and then they're just kind of just left there to rot. Come on, there has to be a way to help these people.
Right, and see, like Corona has made a lot of persons who were like fine have depression. Depression is a mental illness. It is. Right. And a lot of persons might say, oh, I have depression. It's not a mental illness, but it is. So you also need to pay attention to persons who have major depression because they have lost their job, like they don't know how they're going to eat, and they have other issues and other, other stressors are part of it.
How do we identify when someone has depression, when someone is suffering from depression, so that we can have a conversation with that person before they slide deeper?
All right. Normally with the persons who are depressed, they have to be experiencing these symptoms for 2 weeks and more. So like difficulty sleeping, no appetite, like feeling of hopelessness and helplessness, that there is no tomorrow. Having thoughts of harming themselves or their most prized possessions they're giving away, and they're like having certain conversations like there's no hope for tomorrow. So those things have to be happening for over 2 weeks, or even they try to harm themselves. So once those persons are having those symptoms, they are treated as depression.
Okay. And how is intervention carried out in those cases, or even more severe cases? How can family intervene in a safe way without making it worse, or make things escalate to violence, you know? How can family safely intervene?
Well, I mean, if you think that your family member is depressed, what you could do is try and talk to them and see, let them, because sometimes they just want to express themselves.
Mm-hmm.
You can allow them to express themselves, and if you can assist them, then you can. But if it's very severe, we would recommend that they are brought into like an hospital setting, so they can be monitored more frequently, because we don't know what's going on in somebody's head whenever they're depressed, right? And you don't know what plans they have to carry out to harm themselves.
Mm-hmm. Mm-hmm.
So we have to be careful with persons who has depression and it is really bad. It's best to seek medical help and go from there, right?
Okay. And that intervention, you said, could be just talking with them. And what about
Right. And also
people from outside to talk to them? Because sometimes the people in the home, they hate those people first, you know, the person who is the caregiver, huh?
Like also like counselors, including like pastors or persons who are trained, like a therapist or support, they can come, or we can also bring the person to the therapist and let them talk and express themselves, because these therapists, they know how to get certain things out of these individuals and understand what they're going through. So I would recommend counseling.
Okay, so persons in the group, some of you seem to know a little bit about what's going on in the mental health world. So if you know any therapists or anybody like that, please put that information in the chat so that other people could see it, to see just someone who they may be able to call on to come to the home of the person if they can afford to pay for that, or someone that they can bring them to outside of the regular hospital setting so that they can get some help, because we really don't have that information. It
No.
might exist in Kingston and maybe in Montego Bay you have these specialists, but in the country there it doesn't exist, you know.
Right.
So if you guys, like Maxine, if you know of some of these persons, resource persons that people could go to or call to go visit the persons at home or whatever, just put it in the chat so that we can all see that information and try to get help for some of these persons who are suffering in silence in some cases, or some people just left there to, it's almost as if they're left there to die, like no hope, you know, and that's not fair. That's not fair when someone is contributing to society and then suddenly they get sick and there's no help for them. That's really unfair. So
Yeah.
we hope that, because that could happen to any one of us.
Right. I mean, at some point, some persons might say, "Oh, I'm so depressed."
Yeah, it could happen to any one of us. And if you get sick, what? You'll be happy to know that your family just sit by and let you be sick, or the community just let you sit there and rot away because you're sick. Come on, I've seen people here with mental health issues, even RN, you know, and they get treated and is on their job back to their normal thing, but they have to stay on meds. So come on, we can do better as a society, because someone
another thing is also sometimes the patients, they don't have insight and they don't believe that they have a mental illness, so they don't want to take medication.
Yeah, but what do you do in a case like that?
Well, yeah, I don't know. All you can do is just educate them and let them know what is happening. Because I mean, some family members even go to the extreme of recording them. So like if they're in that state and you record them and then they're back to health and then you're telling them, hey, you have this, and they're like, no, I don't know what you're talking about. And then you replay that, then they may believe and say, oh, I think I have it because of what they're seeing. Right. So I most of them don't believe that they have a mental illness.
No, I don't think anything is wrong with them. And that's almost normal to believe that they will think that nothing is wrong with them.
Right.
But
and also they may not want to admit that they have it because they're afraid of what persons might say because of the stigma that is going around in Jamaica. And probably they believe persons may not want to be a part of their relationship, or they don't want to be a part of them because they're saying, oh, that person is mad. Yeah. So I don't want to be with that person because they're mad.
Yeah, but do you leave it there to fester instead of getting help? Because
no,
you can recognize that something is wrong and then you deny it that it's wrong because you're halfway okay to go about your business, and you just leave it there and it gets worse. It escalates. And then, you hit bottom line and everybody gonna know now when you could have gone to the doctor and say, doctor, I don't feel right. Something's happening and I'm not certain. And they could put you on medication, which would be probably very mild at that stage. And you deal with it. Or do you wait until it explodes and then the entire community know and everybody know because no, you're right out crazy, so let's probably just recognize that mental health can happen, is everybody's business, and being sick with some kind of mental health condition, it can happen to just about anyone.
Anybody, it can affect anybody.
Yeah, so no
shame. You can affect everybody.
No shame in that. It could happen to anyone.
Right.
So you had mentioned family support along the way. How important is the family rallying around you, doing what they can to make sure you're in a clean environment, that you do the hygiene stuff, you have something to eat? How important is that in the whole scheme of things?
Well, honestly, it takes a lot of patience and it takes a lot of compromise, and also it takes a lot of education because they can be very hard to deal with, honestly. But I mean, once you want the best for your family member, you will do what it takes to get yourself educated and try your best to help that family member reach back to that that functioning level.
Yeah. Somebody here, Tony, is saying that stigma attached to mental health illness in Jamaica inhibits families reporting it. Yeah, we need to get rid of
that too, because they want to protect their family member, right? Because they don't want. But that's not them. No.
How are you protecting them if you're not helping them to go back into regular swing of things in society? If you're not helping them,
that's what they think, though. They think that they're protecting them by not doing it because, hey, they don't want their family member to have that stigma of, oh, that's a mad person.
That's crazy.
So, maybe that's what goes back to like education.
Maybe the person who is hiding it is also crazy. So,
well,
so that person might need some help too, because we have to understand that this is a natural thing that can happen to you. Something could just go wrong in your brain. It could be a chemical thing. Anything can happen, and it can happen to any one of us who seem normal. when people talk about mental health, I always tell them that I am not even going to say I don't have mental illness, because what if I do? What if I do and I don't even recognize it? Or what if it's in a mild state and it will get worse later on? You don't know. You really don't know. So we should have a culture of looking after each other, knowing that this could be you. This could be your sister, this could be your brother, your mother, your whoever. So we have to create the environment of care and love for these people, so that if it happens to you or somebody close to you, they would also benefit from that treatment,
Right.
or you know. But if we look the other way and say, "Huh, it's not my family, madness don't run in my breed," come on, madness does run in some other people's breed. It takes a community. It goes back to the whole concept of it takes a village, right? And it pains my heart when I go to Jamaica and see people who are living normal, good lives, contributing to society, taken down by mental health, and nobody is doing anything tangible to help them to overcome this situation. So I think we have to broaden the discussion on this. There has to be more that we can do in this area, and we have to find out where these stakeholders are so we could get them involved in the conversation, because we can't be having this conversation by ourselves, and there is really nothing we can do from where we are except to bring awareness to the situation, which we're trying to do here. But we certainly would like to be able to talk to the stakeholders who are in the mental health field, who can tell us, why is there just one person in New Market having a clinic once per month? That's not enough. That's not enough. In your experience for COVID, you're saying that this is also affecting, it's a whole new set of people who are now affected with mental health issues as a result of COVID. So we're multiplying the amount that we had before. Are you seeing a lot of young people showing up with mental health issues since COVID?
Yeah. I mean, honestly, I see mostly young people and mostly males. They're more males than females.
Yeah.
And they're in their early 20s. You might see persons that may be in their 40s and 50s, but it's mostly young people in their 20s and 30s, and mostly males.
Oh God.
And sometimes they also abuse substances and also abuse alcohol, so that even aggravates it even more.
Okay. Yeah. So Maxine says in the chat, once a patient comes in their manic phase and they are being stabilized, they are the best. Yeah, I've seen that. I spent a short time working among some patients who had mental health issues mixed in with developmental disabilities. Yeah, I know they can get really out of hand sometimes, but once they go to the hospital or so, or they, and they get their meds, or there's that intervention, they usually calm down and come back quite normal, quite loving, quite themselves.
So, it's like 90 days.
Yeah. This person could be ripping the place apart in 1 hour, and the police come and take them off in the ambulance to the hospital, and they come back 2 or 3 hours later, a whole brand new person. Yeah, it does happen. So we have to understand the disease. First of all, know what's the problem and what type of diagnosis there is, and then try to deal with it, because like you said, a lot of times the love and care of the family does make a huge difference in the way they behave. That support system is there. It does keep them a little bit more stable than they would have been if they didn't have the love and care of their family and support of their family. So like I said, there's a lot more that we can discuss about this and what we can do in terms of counseling um, counseling for the family members to
Right.
is going to be critical in this
Right. Like, they too experience stress as well, because they
yeah,
have to be running up and down and trying to help the relatives. So they also need counseling.
yeah.
Mm-hmm.
And sometimes it's not even running up and down, it's just the abuse that they take from,
Right. Oh yes, the physical abuse and emotional abuse,
yeah,
everything.
because sometimes they would tell them things that are pretty mean, and
Right.
say and do things that are pretty mean to the caregivers. And so how do you deal with that? How what advice would you give persons who are in this position?
Very hard. It's very hard because I've been in cases where I've been hit by a patient, or I've been told some really hurtful things, and you have to say to yourself, well, you have to remember, oh, they're not thinking in their right minds. But trust me, it is very hard to keep that composure.
Yeah.
It's very hard.
And so that person can become very discouraged,
Mm-hmm.
and when they have to give care, especially
Right.
if it's a long term, period that they're taking that abuse, that constant abuse from this person, um it can become a bit much. And so sometimes it is best that the whole family understand the dynamics and pitch in at different levels, so that one person is not left with the whole burden of of all the care. Because if that's the same person who is getting all the abuse all the time, then
Right.
it can be a bit much. But if everybody else was pitching in at different levels to help, then one person would not have to get all the abuse. It could be spread around, so
Right.
that takes a certain amount of, I think, dialogue and understanding within the context of a family, that they sit down and discuss this and figure out a way, or the best way to deal with it, to handle it, instead of just that one willing person or two willing people putting up with all of the abuse that can come with taking care of someone who has that problem. All right. Is there any general advice that you have for the community, for people in general?
Well, the first thing I would say is to, I mean, you need divine intervention sometimes. You have to pray about it for God to give you the strength and the tolerance to deal with everything. Also, education is very important. We need to get ourselves educated about these conditions, so we have an idea of how to deal with these patients,
Mhm.
because it's hard, and probably we can say, come together as a community and say, hey, we need to do something. What can we do to ensure that instead of the psychiatrist or somebody coming once a month for this, it needs to be changed, and probably get sponsors, or just try to
Mhm.
work together
Mhm.
to make this a good cause.
Right, right. Are you able to do anything from where you are in terms of maybe mental health counseling for, say, family members? Is that something that you could do, like, as a group? If you could identify a group of, like, the caregivers, and you do that counseling, because you can't um, necessarily deal with patients from where you are. So, is there anything like that that you would consider?
Well, uh we do like talk to the family members and try to counsel them, but there's somebody trained at the hospital that normally comes and speak to the persons and
Mhm.
try to get a hang of what is going on and try to reassure them and support.
Okay.
So yes, we do counsel them, but there's somebody there that does it.
Okay, so you're saying it's better we go find the people who are trained to deal with that specific thing, because they do exist. But
Right.
they're just not active in our area. So yeah,
Right.
so we will dig more into that and see, and I hope we can continue more, and you could share more information with us as time goes by on mental health, because we do need to have
Yeah.
more discussions about this, and shine more light on the fact that we just are not putting enough emphasis on it. There is no support or little
Right.
support. That is not enough, and we have to start being more caring about the people around us, because like we said, it could happen to any one of
Right.
us. So if we don't have systems in place and this happened to us, then we're going to end up just like the other people that we pass and stick our nose in the air. Yeah, it could be you, right? So we in helping these people, we might be helping ourselves later on. We don't know. So the time to start is now. So let me thank again the people in the group, in the chat, who are watching and participating. Thank you for your help, guys. And remember, if you know anyone who's a specialist in this area that we could reach out to on a private basis or outside of the hospital setting, please put the information here so that members of the community can access that information. I want to thank you, my dear, for your generosity in agreeing to come on here and speak with us. It was a
Sure.
very it was a very enlightening conversation. And like I said, I hope that we can do much more of that as we progress with this initiative for the community. It does take on a whole lot of different areas, and mental health is almost top of that list. So thank you again. Thank you for your participation. Um,
No problem.
we will have more talks later on, Debbie. Maybe panel discussions and so on. The month of April that's coming up, we'll be looking more into males and what's going on with males. So there might be panel discussion there that we might need your expertise. So take good care now, and God
Thank
bless.
you.
Thank you. Anybody you want to shout out before you head out? Debbie? Okay, so like she probably is gone because I'm not hearing her anymore. All right, guys. You there, Debbie?
Yes, I'm here. I'm not sure what happened.
Okay, so I was saying, is there anyone you want to shout out or thank and before you part?
Well, I want to thank you for actually making me a participate in this, and
Thank you.
I would also want to thank my aunts for recommending me to be here, and I want to thank everybody that came and listened to what we spoke about, and I hope eventually that we reach a point where we can help persons with mental illness and we can do more as a community.
Sure. Thank you very
Thank
much. Ladies
you.
and
Are welcome.
gentlemen, you heard from Debbie Cameron at RN, who's working in the United States of America right now. She works in the field of mental health. Tonight, we focused on mental health. We hope that you join the discussion on Facebook. Put your thoughts there. She will see it, and we can keep back and forth with this conversation long after we sign off here. Thank you very much. Thank you for listening and watching us here on the New Market St. Elizabeth page. Have a wonderful night, everyone. God bless. Take care.